Hi, my name is Craig Hoffmeister from The Ohio State University, and these slides are about how to pay for your myeloma care. These slides were sponsored in part by multiple myeloma opportunities for research and education, for which Nancy Kaufman is president. Based on a 2007 Kaiser Permanente study, what is the most common reason for personal bankruptcy? If you guess healthcare costs, you are right. And multiple myeloma is not a cheap disease. We're going to talk about what you should do when you were initially diagnosed, how to find government-sponsored assistance, and with an eye on Ohio, where to look for local and community-based assistance programs. We see patients at Ohio State University who oftentimes have no insurance, no resources, and come into our emergency room sick, and 5 days later ultimately find that the reason they're so sick and have kidney disease, anemia, and potentially a fracture all at once is because of multiple myeloma. These patients clearly meet criteria based on the federal government for disability, meaning that they cannot do the work that they did before, and they can't do any other type of work because of their myeloma. In addition, this period where they're not able to work has lasted or is expected to last for at least 1 year. Patients with relapsed myeloma, or for up to 1 year after autologous stem cell transplant, often are thought to meet federal government-defined criteria for disability. To apply for Social Security disability, you can call an 800 number, go on their website. Many programs require Social Security disability approval. This provides monthly checks, and for those patients who do not qualify for Medicare based on age, if they do qualify for disability, this allows them to obtain Medicare benefits after 24 months. Note, there is a benefit delay of approximately 5 months, and hence sometimes there's SSI resources available during this period of time. For our patients, sometimes just in the hospital room, they can look to obtain resources and assistance. Talk to your local social worker at your hospital. Most hospitals will have a federally funded hospital care assurance program, an HCAP program, for which they apply, and based on your adjusted gross income over the last year to 2 years, you can often have many of your care, such as medications, chemotherapy, and even the hospital stay entirely, be funded through this HCAP program. At our hospital and at other hospitals, there are pharmacy assistance programs for which members of that assistance program will meet with patients. At our institution, Evelyn Shaw is a fabulous resource and meets with our myeloma patients as well as other blood cancer patients who need medications and can't afford them. When you're diagnosed, oftentimes there are numerous things that you may be able to do to protect some of your assets. To try to get some money to pay for your care initially, you can get early access to your retirement funds, but clearly there are some penalties to be paid. Contact your credit card and mortgage companies, update them on your medical status, and they may be able to change payment requirements or interest rates. Sometimes the only way to get rid of student loans is through multiple myeloma. Contact your loan officer and talk about deferment, forbearance, or forgiveness. Reverse mortgages and certain life insurance policy manipulations may allow you to get access to financial resources immediately for capital you have already put into your house or life insurance policy. there's a number of government-sponsored assistance programs. This slide deck can't at all even dent the surface of the complexities of Medicare, Social Security, the health insurance marketplaces, Medicaid, or even the VA benefits. But we can at least overview some of these for myeloma patients. FMLA is important for patients and their caregivers, and it allows 12 months or 1,250 hours of employment before leave, and work location has at least 50 employees. These are two key requirements for patients to get access to FMLA, and this entitles them to a 12-week unpaid leave for serious health conditions, both for the patient or their caregiver. COBRA, both from a federal standpoint and from a state viewpoint, are likely to be phased out with the Affordable Care Act. For those veterans who have 24 months of military service or were disabled in the line of duty and were not dishonorably discharged, they can sometimes get reduced co-payments depending on their finances. Benefits may include specialty care services for their cancer, and it's important to note that myeloma is an Agent Orange linked diagnosis. There's more information on this on the U.S. Department of Veterans Affairs website. The health insurance marketplaces, which opened in October and kick in on January 1st, were enacted by the Affordable Care Act. Patients cannot be denied coverage on this marketplace, and lower incomes may qualify for additional support. Paging through a Consumer Reports issue from September 2013, I found a top 10 list of private health plans specific for Ohio. A little later in that issue, I found a top 10 list of Medicare Advantage plans specifically for patients in Ohio. Your adjusted gross income dictates the type of assistance you can receive when purchasing your own plan in the marketplace. And looking at the federal poverty level, you can see that additional insurance is available depending on your adjusted gross income, and Ohio is not offering any additional help beyond federal mandates. If you earn greater than 400% of federal poverty level, you will not obtain additional assistance with your health insurance marketplace premiums. Medicaid is primarily for patients less than 65 who have an income less than 133% of the federal poverty guideline. This is federally mandated, state administrated, and as you can see on the lower left-hand side of the screen, based on the number of persons in your household, and really it's for patients who have almost no resources. Medicare is for patients who are age 65 and older, or younger patients on hemodialysis or peritoneal dialysis, or patients who've been receiving Social Security disability for more than 24 months. Now, there are two pathways for Medicare, the original Medicare and the Medicare Advantage pathway. On the left-hand side, you can see the original Medicare pathway includes Part A, Part B, and a Part D pathway for prescriptions, which is optional, as well as a Medigap policy. On the right-hand side, you can see the simpler Medicare Advantage pathway, which generally builds in Part D or prescription benefits. There are patients who qualify for both Medicare and Medicaid, and these patients, again, have extraordinarily few resources, and Medicaid fills some of the gaps in coverage for those on Medicare. The famous donut hole is described on this slide. This is the 2013 standard Medicare prescription drug coverage, and After the first $325 deductible, there's initial coverage where the plan pays 75% of the first approximate $3,000 worth of spending, but the donut hole covers between $3,000 and approximately $7,000. And this is a significant hardship for myeloma patients who occasionally take very expensive oral medications. After $7,000 worth of coverage, the enrollee only has to pay 5%. But getting through the donut hole is a primary problem. Now, while those briefly reviewed some of the federal assistance programs available, looking closer to home is very important. Oddly, the American Cancer Society and Leukemia Lymphoma Society, both organizations based outside of Ohio, have a tremendous knowledge of resources available in Ohio. And we always recommend patients call the American Cancer Society at the time of diagnosis to see what is available locally for assistance. The Leukemia Lymphoma Society is another fabulous organization that has really people on the ground in most states, especially Ohio. They have a simple program to help defray some expenses for newly diagnosed patients with myeloma and for those who continue on with myeloma survivors, where they can help defray costs for just $100 with a simple application form. We'll talk later about their copay assistance programs. There are state and region-specific services to help patients. Anything from food to cancer care to transportation, all are available primarily on this slide in Columbus, and you can see food and travel as well as general assistance through the Western Reserve Area Agency on Aging in and around the Cleveland area. Additional resources of this same type are listed on this slide for Cincinnati, Dayton, and Toledo. Faith-based services are prominent in many major cities, and we've chosen to look at Catholic Charities here as a very comprehensive network around the state. And you can see through the Cincinnati area, Cleveland, Columbus, Dayton, Toledo, Youngstown, there are numerous Catholic charities with their websites and phone numbers listed on this slide. Unfortunately, many of our patients often come into a diagnosis of myeloma in debt, and because of myeloma lead to further debt. And these are two very reasonable online sites to provide personalized solutions to get out of debt. Two of the main ways to drive you to and from healthcare are the Cancer Care Door-to-Door program as well as the American Cancer Society Road to Recovery program. While slightly less common, there's flight assistance available for a variety of cancer patients listed on this slide. Housing for patients and their families are very appropriate for patients on clinical trials or when they're obtaining care greater than 1 hour away from their home. So the Hope Lodges, Joe's House, and the National Association of Hospital Hospitality Houses can provide a number of areas to stay in and around the state of Ohio. Many of our patients have trouble paying for basics, rent, heat, electricity. Ohio has a one-stop shop, the Ohio Energy Assistance Program's application here, to allow patients one area to see what they'll be eligible for. There are other sites, the Team Continuum, NeedHelpPayingBills.com, and Cancer Care that can provide some limited financial help. For myeloma patients with expensive oral medications, the Leukemia Lymphoma Society has a copay assistance program for up to $10,000. The Chronic Disease Fund and the Patient Access Network Foundation are three of the most common assistance programs for our patients with myeloma who are often trying to pay for expensive oral medications. Patient Advocate Foundation and the Assistance Fund also help patients with myeloma who have expensive oral meds. Because each site that helps patients runs on tight budgets, and a lot of the assistance they provide is quite significant. They can come to have money to give out, and then at the end of the month they have nothing. Hence, going to websites to just point you to areas that may have resources available is reasonable. And hence rxhope.com, pparx.org, and needymeds.org are three of the best online resources that in and of themselves don't give out any money, but they point you to resources that may be available to help you save money on medications. Each pharmaceutical company has programs to help patients who qualify to receive their medications. So Celgene, Millennium, and Onyx all have well-developed programs to help patients receive their medications